Hello, and welcome to Tokyo College's online program. I'm Haneda Masashi, director of Tokyo College and moderator of today's event. At Tokyo College, we are planning to organize a series of online dialogues between the University of Tokyo and its overseas partner academic institutions on perspectives of society after COVID-19 and make them public on the Tokyo College's YouTube channel. Today's event is one of them. Collège de France, a precious partner of the University of Tokyo, is without doubt the most prestigious academic institution in France. Distinguished researchers there are working both in the fundamental research and teaching of their cutting-edge research achievements. University of Tokyo held a university-wide forum called Todai Forum at the site of Collège de France in Paris in 2011. One picture, your right hand down, no, please go back, is the picture taken at that moment 10 years ago with our President Hamada in those days. And the two institutions have collaborated very closely since then. Today's dialogue is planned based on this solid ground of mutual trust and cooperation between the two institutions. In the middle of the COVID-19 crisis in 2020, Collège de France held a series of online multidisciplinary public talks related to the pandemic by its members. The series is, could you have one next slide? Yes. The series is called Initiative COVID-19, COVID-19, and certain videos discussing the issue from various aspects are uploaded on the Collège de France website. The organizer of this wonderful series is Professor Philippe SANSONETTI, who is with us today. Likewise, Tokyo College produced two series of symposiums where we discussed a lot on the COVID-19 crisis in 2020 and in 2021. Professor NANGAKU Masaomi, who joins today's dialogue, was the moderator of a panel on medical science and epidemiology, both in 2020 and 2021. So we have two wonderful experts of the COVID-19 related issues in France and Japan today, and looking forward to their lively exchange of rich information and innovative views. Let me introduce today's agenda. At first, two professors will introduce themselves and make a short speech of 5 minutes, which includes some keywords and points for the next discussion. Then I will ask them a couple of questions. After answering these questions, they communicate each other freely till the time comes to an end. Well, let me ask Professor SANSONETTI to start your talk. It would be great if you include your understanding of the current COVID-19 situation in France. Please.
Thank you very much, Professor Hanada. I'm delighted to participate to this conversation with my colleague, Professor Ngaku. If we can show the first slide, please, I would just briefly introduce myself. So I'm Professor Philippe SANSONETTI. I am an emeritus professor from the Institut Pasteur in Paris. I'm medical doctor, infectious disease in terms of training, but I soon turned to basic research, trying to decipher interactions between microbes, especially bacteria and cells and tissue in the course of infectious diseases. It's really sort of interrogating about the molecular crosstalks that are initiated when a microbe meets a cell or a tissue. in the course of an infection. So this has made my career, and I also developed vaccines against enteric infection for children in the developing countries. I started to be chair of the microbiology and infectious disease at the Collège de France in 2008. That has lasted for 12 years. It's been a great, in the way at the end of a career to sort of summarize your research, integrate your research in other scientists in your field and others. And it was really a great experience to teach at the Collège de France. A good chunk of my teaching actually was dedicated to emerging infectious diseases, and I insisted on the risk, and I'm not sure I've been listened to so much, because when France was struck by this pandemic of COVID-19, it looks as if we were rediscovering the wheel every time something happens. As shown on this slide, I'm also a member of several academies, France, Academy of Science, and elsewhere in the United States, UK, Germany, and so on and so forth. So it's been an interesting career trying to deal with fundamental aspects of infection, but also trying to expand to the more, I would say, global social and public health aspects of infectious diseases. On the next slide, which is not an advertisement because it's a non-profit institution, EMBO is the European Molecular Biology Organization, and it has journals. And one of these journals is EMBO Molecular Medicine, and I'm the editor-in-chief of this journal, which I advise anyone to check the website for those interested in molecular medicine. I think it's a high-level journal, and we like to publish in this journal. So this is all for my slides. And as said by Professor Haneda, very soon when France was hit by the COVID pandemics in February, March 2020, we decided that the Collège de France should be present on this field and try to do what is the aim of the Collège de France, which is to try to decrypt, to decipher complex situations for the population, and try to express this under different forms, including in the modern media. So it was clear from the beginning that COVID-19 was something absolutely unusual and mostly, unfortunately, unanticipated. And I started to teach and took this initiative, as was said, which we called the COVID initiative, to get all my colleagues, professors, we have more than 50 of them, to reflect about the COVID-19 pandemic under their own angle. Could be, of course, basic science, medicine, history, sociology, demography, and so on and so forth. And I must say that this was a great experience, and I'm sure you had the same at the Collège Tokyo. We realized immediately, of course, that this pandemic would be a big challenge on the society, especially on the poorest individuals of this society, as usual in the course of pandemics. We also immediately insisted on the fact that this pandemic would not just be, if I can say, sort of medical and public health issue, but also a more global issue hitting on the government, on the administrations of the state, on the politics, on the finances, and so on and so forth. And very soon also we realized how this pandemic was sort of splitting the population, and the conception of the behavior that citizens may have in front of such a pandemic was put in question. There were very strong discussions all the way on the notion of freedom, for instance, which was questioned by the fact that suddenly citizens had to respond to hygiene measures like wearing masks and social distanciation, and this was considered by many as a sort of attempt to reduce their freedom, and it had become an even more of a problem when the vaccine became available and that some of the population didn't want to respond positively to this necessity of vaccination. So COVID-19 has been, as we used to say, a sort of crash test for a lot of aspects of the way our society operates on a regular basis, and it has really put some tensions which are still sensing. But I think, and this will probably be most of the discussion with Professor Ngaku, the idea was more here to stress our medical system as a target and of this COVID-19 epidemic, the clinical research and the basic research, also possibly the attitude of the population. I don't know how it is in Japan. There is an increasing defiance of the French population against science, and it goes with defiance against the institutions and the governments. So again, this COVID-19 pandemic is really putting us under stress, under tension, and has revealed weaknesses, but also strengths. And I think we should be optimistic that something positive will also come out of this COVID-19 pandemic. So I think this might feed a little bit our discussion later as we organized before. So this is what I wish to say as an introduction. And we're very proud that the Collège de France has played a role to help the French population better understand this crisis and try to give some tools to analyze and make the proper decision when the time comes.
Thank you very much, Professor SANSONETTI. Now it's your turn, Professor Nangaku. Could you start your 5 minutes talk, including your understanding of the current situation of COVID, the current COVID situation in Japan?
Thank you very much, Professor Haneda. First of all, I'd like to thank Professor Haneda and the team of the Tokyo College for giving me an opportunity to discuss this important issue with Professor Philippe SANSONETTI. It is my true pleasure and honor to participate. Can I have my first slide, please? Let me introduce myself. I am currently serving as a Vice Dean and Professor of Division of Nephrology and Endocrinology at the University of Tokyo Graduate School of Medicine. I am also a Vice President of the Japanese Society of Internal Medicine, current President of the Asian Pacific Society of Nephrology, and the President-elect of the International Society of Nephrology. So I am a specialist of kidney disease and internal medicine. Next slide, please. As a member of the Japanese Society of Nephrology, we contributed by providing the guide of management of COVID-19 in patients with kidney disease because they are very susceptible or weak to COVID-19 infection, high-risk people. Next slide, please. In addition, I had chances to chair the committee of the Japanese Medical Science Federation to launch a COVID-19 expert opinion and proposal about implementation and development of COVID-19 vaccines. The Japanese Medical Science Federation is the biggest association of the medical sciences, and 129 medical societies belong to this Japanese Medical Science Federation. And while each society published guidelines separately, we decided to publish it in combination for easy use. And I would like to give you my understanding about the current situation of the COVID-19 in Japan. The first case of COVID-19 in Japan was reported on January 16th last year. This patient had a history of travel to Wuhan in China. At the beginning of April last year, the total number of COVID-19 patients went over 3,000. This is so-called the first wave, and the Japanese government declared the first state of emergency on April 7th last year. This was lifted 1 month later. And after that, we had 4 waves, in total 5, The biggest wave came this summer, which we speculate was related to the Olympic Games held in this summer. On July, the government declared the fourth state of emergency. On August 6th, the total number of COVID-19 patients in Japan went over 1 million. The largest number of new patients per day was 25,876, reported on August 20th. Many patients died at home because they could not be hospitalized, and lack of hospital capacity became a serious issue. Another shocking news was the one that one mother with COVID-19 could not be hospitalized. One pregnant woman with COVID-19 could not be hospitalized and had to deliver her baby at home. The baby died at home and people started to get really scared. Probably because of these tragic events, people spent every effort to protect themselves, and we now have a rapid decline in the number of new patients after that. The state of emergency will be lifted tomorrow. The serious issue during this was infodemic, as you know. Many false or misinterpreted information was spread, and the Tokyo College team, led by Professor Haneda, spent every effort to deliver the right and scientific information to the people during this pandemic, which turned out to be a big success. So I'm very happy to be here again and contribute to the Tokyo College activities. Thank you.
Thank you.
Thank you very much. So now let's move on to the discussion session directly. Well, I have a couple of questions. So I will ask both of you first, and then if you please respond me. Please give me your answer, and then you will exchange your ideas and views each other. So the first question is that this one, at this very moment, more than a year and a half after the breakout of the pandemic, how do you evaluate the current situation? You have already talked about this already, but please tell us more about the strength and the weakness of French and Japanese system, which is a little bit ambiguous, broad word, but maybe hospital organization or prevention of epidemics in the field. In these fields, how do you evaluate your system in France and in Japan? First, Philippe, please.
Well, thank you for this, in a way, central question. The situation in France at the moment is, I must say that we haven't had this fifth wave, or it has remained very, very limited. What I heard from Professor Ngaku is exactly what we observed in April last year, which is this very, very strong tension on the medical system. Of course, we realized that we didn't have enough beds available in such exceptional situations, particularly in terms of ICUs, emergency units. People also realized, the population, that it was not just an issue of number of beds, but it was an issue of number of competent people, doctors, nurses, aid nurses, able to essentially take care of these patients, even if there were an increased number of beds. We soon realized that we had a shortage in competent personnel in regard to the situation, and that the reserve was very limited. But still, we could cope. At the peak of the epidemic last year, we had 7,000 people hospitalized in ICUs, which was very, very close to the upper limit and even beyond in some areas like the Paris area or the southern part of France. Why we don't have, at least for the moment, you can never say anything with this coronavirus, a fifth wave, I think, is one positive aspect. which is that the vaccination, even if it has started slowly at the beginning of 2021, has now covered a large proportion of the population, up to 80% of the population that should be vaccinated is now vaccinated with 2 doses. Adolescents are vaccinated up to 80% now, which is totally unexpected, as we started the vaccination campaign with a very strong anti-vaccination attitude of a large part of the population due to the fact that the vaccine was new, that it was a new technology, that we had no background whether it would work or whether it would cause possible side effects. But I think the population has quickly realized this is the country of Pasteur. There might be something left from that in our culture. And maybe unlike some aspects of the Asian population, it's been very, very difficult to convince the French people, the French population, of the need of very strong hygiene measures, like wearing masks in all situations, like the social distanciation in a population that is used to kiss and express its friendship and in a very close kind of manifestation, physically speaking. All this was extremely difficult, and as I said at the beginning, kind of perceived as an attempt to personal freedom, not necessarily considering the global freedom issue, which is to get rid of this pandemic. So basically, I think we did not very well with regard to the prevention measures in terms of public health protocols, but we, in retrospect, did quite well with regard to the vaccination. And as long as we don't see any new variants appearing, the Delta variant is kind of, a little resistant to the vaccination, but with 2 or 3 doses, it seems to be okay. We have avoided this 5th wave for the moment. One consequence that we will not be able to measure before a while is the fact that due to the saturation of the hospital system for many months, not just ICUs, but also regular beds, we had to deprogram a lot of surgery and treatments, hospitalization of people suffering from things different from COVID-19, like cancer patients, for instance, or people with autoimmune diseases, some transplantation of organs. So this is a secondary effect on the medical system that will be measured within the next few years, but it's already clear that there have been delays in diagnostic and treatment of cancers, which will certainly have an impact on the global health of the population.
Okay, how about you, Professor Nangaku, your evaluation about the advantage or strengths and weakness of Japanese system?
Thank you. I'll tell you my understanding about the strength and weakness of the Japanese medical system. In Japan, most hospitals are private, and we are under strong pressure to make a profit. The requirements to make a profit is that hospitals need to do many surgeries, discharge patients quickly, and make beds of hospitals always full. That is our medical system. Otherwise, hospitals will go into the red and become bankrupt. This system does not allow us to keep beds empty for future COVID-19 patients. Once COVID-19 patients come to hospitals, they stay for a long time. And hospitalization of patients with COVID-19 requires a huge resource and manpower. All these factors are against the profitable management of hospitals. Eventually, the government decided to compensate for these losses, but they made this decision very late. In addition, many hospitals in Japan are very small. Our hospital, the University of Tokyo Hospital, is one of the biggest in Japan, with 1,200 beds. But 70% of the Japanese hospitals have less than 200 beds. it is difficult for small hospitals to take care of patients with COVID-19 for many understandable reasons. For example, they do not have space to separate patients with and without COVID-19. They do not have manpower. In addition, the Japanese government strongly promoted community medical care concept, and this led to division or separation of regional medical care systems. Actually, this was the strength of our medical system under the normal situation. This system allows a meticulous care to patients with easy and free access to any hospital they would like. But this system was optimized to take care of patients with chronic disease in the super-aged society. This strength of our system turned out to be the weakness under this crisis, according to my understanding. Professor SANSONETTI mentioned the vaccination issue, and I agree with you, and the situation was similar in Japan. Vaccination was delayed in Japan for a number of reasons. Last year, the paper of mapping global trends in vaccine confidence and investigating barriers to vaccine uptake was published in Lancet. And this paper concluded that Japanese people have the least confidence in vaccine probably because of some historical reasons and other reasons. So the start of vaccination was very slow in Japan. At this moment, about 60% of the people got vaccinated. So probably the issue will be how to convince those who do not believe in vaccination, as you pointed out, to get vaccinated from now on. Thank you.
Well, thank you very much, both. Professor Nangaku mentioned the status and size of hospital in Japan. Status, that means whether it is private or public. And the size is rather small in Japan. We don't know quite well the hospital system in France, but so far as I understand, there are some private hospitals and public hospitals as well in France. How do you think about the situation explained by Professor Nangaku in Japan?
I think it's not that I think. I mean, the French system is quite different. It is really dominated by public hospitals. And in the case of a crisis, it's really the public hospitals that take care of the patients. Actually, there is a permanent debate because the private sector says, we are there. Why don't you use us in case? You know, we had the same situation during the terrorist attacks in Paris in 2015, where all the people, the wounded people were hospitalized in public hospitals. And we have big public hospitals. I mean, a public hospital like Pitié-Salpêtrière in the center of Paris has something like 4,000 beds. So the size is much bigger than it is clearly compared to Japan. So the public system has tried to handle this, and at the beginning of the pandemic, the private hospitals were kind of marginal in their intervention. Most of them didn't have the capacity, for instance, in terms of resuscitation and intensive care. So public system was under pressure mostly. Problem is that the public system, the hospital public system in France, over the last, let's say, 20 to 30 years, has been treated like the private hospitals in Japan. It's been requested from our public hospitals to be profitable, and the mechanisms that Professor Ngaku described, which are probably good systems and mechanisms in period of regular situation in terms of health conditions, that does not clearly respond to a crisis situation like COVID-19. So this is really creating a very important issue for the future, which is how can one adapt our system to give it the flexibility to respond to this crisis situation without getting into creation of an enormous number of beds and that will not be used most of the time. The second issue, if I may add at this stage, because it's very important in France, is that the French medical system by tradition has been oriented towards treatment. It's a curative system. And I must say that it's very well organized in general. And the social security system is extremely generous for the entire population. All the population, in theory, has access to medical care. And you can basically enter a hospital, be treated, and get out without having to spend a euro. So that is okay with some of the tensions which I mentioned. What we miss, which might probably protect the hospital system in this case of crisis, is a true medical culture oriented towards prevention. Medical prevention has never been very strong in France over the decades, over our medical history in general. And, it has even it's getting worse over the last years. For instance, the school doctors, there are very, very few of them now. And COVID has shown that it's very important to be sure that our young population is in good health, that we can vaccinate them quickly. The medical care or medical prevention at work is not very good. There are very few of these doctors because no one is interested to do this job. It's not very well paid. So I think we have to reconsider our preventive medicine. Our health agencies are usually isolated on their own campus. They should be merged with the academic system on the university campus. They should be given more financial means to develop research in epidemiology, in the modern angle of epidemiology. We started this epidemic last year with very, very few people able to model infections, make anticipations on the situation, build scenarios, and allow the government, the states, to basically rationally build its response to the epidemic. We had very few, most of them were at Institut Pasteur, actually. And in comparison to the UK, who has this very, very strong tradition of preventive medicine and basic research in public health, we looked very much playing in the second league. So we really need, and this will be a lesson of this COVID-19 pandemic, to rethink and build our preventive medicine. Otherwise, anything happens, hospital will be hit, and will never show the capacity to fully respond to these situations of crisis.
How about this difference between preventive medicine and curation medicine, Professor Nangaku, in Japan?
Thank you. I fully agree with the view by Professor SANSONETTI. Preventive medicine has shown its most value ever under this condition. So far, preventive medicine was not so popular in Japan as well. Mainly, preventive medicine was discussed from the point of view to reduce the medical expense. The government said, if you become sick, you will spend a lot of money, so do not get sick. And they tried to do preventive medicine for that sake. In addition, from a point of a clinician, I think doctors will feel their values when they cure patients. For example, surgeons will feel most their values when they do surgeries and save lives. If we do preventive medicine, keep people healthy as they are. So I think it would be more difficult for doctors or medical staffs to feel their values when they are involved in preventive medicine, and we have to change that culture. We have to pay more respect to preventive medicine. That's what I thought.
And Professor Sansonetti touches some aspects of cultural differences between Europe or the West and Asia or East Asia. We have a lot of things to discuss about this, and I'm afraid that we don't have enough time to discuss in detail this point. But respect of social values and some usual social customs in the West and in Japan are somehow different. That is true. And very short comment from Professor Nangaku would be very grateful. Do you have some comments about this aspect of difference? Or
Yes, we Asians do not hug. We put off our shoes when we enter our houses, and we wear masks even before the pandemic. So we believe this has been beneficial for people in Asia, but it is pretty difficult to prove that hypothesis scientifically. So I'm wondering how we can prove this.
Okay, thank you very much. And next question is that both of you are a researcher. So in this respect, I'd like to ask you some impact of the pandemic on your clinical research or pure research activities. If you have any, please let me know. Professor Sansonetti first.
This is a very good question, to be honest with you, and it forces to think a little bit in retrospect. I think what I've realized, maybe I was, I was aware of that, and I've been working on my career to try to not only get into the depth of basic aspects of microbe-host interactions, but also develop vaccines, for instance, have a sort of translational dimension and make sure that your research helps people. What was very interesting, seen from my institute, I'm talking about the Institut Pasteur now, is that science clearly has helped to deal with these pandemics at all stages, from the early diagnostic characterization of the virus, development of tools, development of vaccines, and so on and so forth. So without science, we would be now in the position of the world population during the Spanish flu in the early 90s. But at the same time, I realized that what the population was expecting from science was solutions. So you can always explain that you found this fantastic virus and identified variants and identified the mode of entry into cells and replication of the virus. And all this, the population doesn't care so much. What they are expecting is a treatment and a vaccine. I've realized that our scientific system in general, at least in my country, doesn't sufficiently support this aspect of things. There is not enough financial means to support the translation from basic science to developing tools for the treatment and the prevention of a pandemic like this. And we've done, I must say, rather poorly in general. We have failed on the vaccine so far. We have failed, but that's not just us. It's the whole system in developing new treatments. And we know that it's very difficult to develop antiviral drugs, specific antiviral drugs in a short period of time. But still, I've realized how much the population was expecting applications, practical tools to control this crisis situation. And I'm not sure that the system as it is organized and as it is funded allowed us to answer to this attempt to these expectations from the populations. Other countries did much better, clearly. One is the United States. And when you look at the situation, they have been thinking about how to get organized against these pandemics for decades now. They have secured the money and the systems necessary to, at the right moment, identify the right candidates, the right biotech companies, the right university groups, and fund them massively to quickly develop. So I think there is a model that has emerged of the global response against pandemics, and we've been very late on that and insufficiently funded in general.
Same question to Professor Nangaku.
Yes, from my personal point of view, science contributed to the society amazingly under this condition. The first story of COVID-19, the pneumonia of unknown cause in China, was reported at the end of December in 2019. And within 1 month, scientists revealed that SARS-CoV-2 was the cause of this disease. I did not expect that people would be successful in development of vaccines in such a short time. But now we get vaccinated, and we are even giving the neutralizing antibody to treat patients with COVID-19 at the early stage. So I think what the people did was amazing. But unfortunately, the Japanese did not contribute much to this field. And I think the most important thing is to keep the best basic science. It is basis for scientific advancements. Recently, the policy of the government became, short-sighted, and they required immediate outcome and benefits out of researches. And this forced investigators to do more critical researches rather than basic studies. Basic science is the basis for everything. So I think we have to pay more respect and put more emphasis on basic science for what will come, what is unexpected at this moment, and what will come in the future.
Yes, I wanted to ask both of you the future prospects from now on, because we have already discussed a lot about the past and present, and certainly we will need to discuss more about the future. But both of you have already mentioned the science in the future, or hospital system in the future, and you have already known a lot. You have already obtained a lot of, I'll say, knowledge, which will create our future society and hospital system, I suppose. But at the same time, maybe I want to ask you once again, what do you think about the future? Even if we overcome the pandemic of this time, maybe the next one will come to attack us. You have any good idea about our future society system, and in particular science and hospital system? If you have any idea about the better future, please tell us. Dr. SANSONETTI?
I'm ready to say. It's, of course, it's a difficult situation, but we need to think about it. I think I have good worries. I would fully agree that I hope this crisis has shown the weak points of our hospital system, of our preventive medicine systems, of our scientific system with regard to insufficient basic research and insufficient mechanisms to turn basic research quickly to control tools in case of a crisis. So all this is kind of setting a huge agenda. And I'm afraid that a weakness of our democracies is that, all the mandates are short-term mandates for politicians who are in charge of implementing these big reforms, which are requested at all levels. France has its election of the President of the Republic next year. We already see in this pre-campaign that is developing in the media that most of the topics that are addressed have nothing to do with the pandemic. I'm afraid that once the pandemic is under control, and we are far from there, at least at the level of the planet, our dear politicians will just forget. They will try to fix things here and there just to show that they are doing something. But COVID-19 has shown that we need more than these very punctual and limited reforms that makes politicians tell the electorate that they have done something. I mean, we really need to get to something more ambitious. And this is part of my worries. I'm not sure this will happen as I would, or as we would expect.
Professor Nangaku.
Yes, thank you. As Professor Haneda pointed out, something will surely come in the future. The other day, I met one virologist in Japan, and he told me 20 years ago, we had SARS, but it did not come to Japan. It happened in China, Hong Kong, and Taiwan, but not Japan. 10 years ago, we had MERS. It occurred in the Arabian countries, but it did not come to Japan. So every 10 years we have this kind of thing, and we could have expected this, but we never imagined it would happen in Japan, and it happened in Japan. So in the future, this kind of thing will happen again, and we have to get prepared. One important system we have to launch, I think, is telemedicine, because the COVID-19 pandemic revealed the importance of remote medicine. This is also important for Japan, because Japan is the super-aged society, and there is the problem which is called 2040 medical crisis. In 2040, the ratio of aged people in big cities are overwhelming, and medical staffs will be called back from the remote areas. This will lead to medical crisis of remote areas, but also they cannot deal with too many aged people in big cities. And in 2040, we expect that medical system will be crushed. To prevent this, we have to launch a good remote medicine system, telemedicine system. And in collaboration with the Department of Engineering, the scientific advances in engineering is remarkable. So I believe we can launch a good system.
Okay, thank you very much. The last question from my side is that the aspect of international collaboration. We have discussed a lot about our own system, France, Japan, but have we sufficiently collaborated internationally in terms of prevention or in terms of hospitalization, etc., or sharing the knowledge on COVID-19? How do you think about that? If we have something to do more about this aspect, please tell us. Professor SANSONETTI, please.
I think for France, it's a complicated situation because our international connection goes at two levels. One is at the European level, the European Union, and the other one, of course, is worldwide. I must say that the European system has not done very well at the beginning because in the framework of the European Constitution, issues like defense and foreign affairs and health are left to the individual states. So it was very, very difficult, and it took time to get to a common attitude, especially, for instance, to preempt vaccines for the time it will become available and so on and so forth. But if we come to research, I think scientific community has shown the proper example, because in general, the sharing of the data has been extremely quick. When you look, as it was reminded by Professor Ngaku, in January 2020, when the virus became available, the sequence of the genome became available first, actually. This was shared immediately all around the planet, and people could start developing any place PCR assays to start to follow the development of the epidemic. The discussions about vaccine development were held very early in meetings, and the sharing of the knowledge of the clinical trials became immediately available. I think the scientific establishment has shown the right example in terms of ethics with regard to freedom of availability of data and exchange of this data. So on this side, I'm pretty optimistic that whichever crisis comes up in the future, and there will unfortunately be other emerging infectious diseases, the system has shown its capacity.
Professor Nangaku?
Yes, I fully agree with you, Philippe. Science has shown a very good example. Scientists made a great collaboration, shared the knowledge immediately and honestly, and have been very sincere to combat against COVID-19. The problem is the social system. Science is common everywhere in the world, but social systems differ everywhere. And launch or implementation of science needs understanding of the social system. And the medical system or the social system is different from UK, France, USA, and Japan. And nobody understands every single medical system of these countries. Maybe 2 or at most 3, but not all. So the implementation of what scientists achieve will be an important problem.
Thank you.
If I may just add one point to this, which we have not mentioned, unfortunately, it's my fault, in a way, is the fact that we are nicely here dealing in a very critical way with our systems of rich countries. We tend to forget that 2/3 of the population of the planet do not live in such conditions. If you take vaccination as a marker of, capacity to react to the COVID-19 pandemic, if you take average African countries, the percentage of the population that is currently vaccinated is 3%. So we are very proud of our 70 or 80% in the north, let's say, but please now look at what's going on in the south. And if we wish to eliminate this virus on the long term, it will never happen if the poor population of the planet is not vaccinated. So I think the next step now, and it should be engaged as soon as possible. I hear about it, but I'm not sure much is done so far. We have a bit selfishly taken care of our situation, but we tend to forget the rest of the planet.
Thanks for raising this point. And as the president-elect of the International Society of Nephrology, we often discuss this issue. there are many new drugs, most often expensive, which were shown to be effective in kidney disease in big clinical trials. But how can we launch the benefits of these expensive drugs in the developing countries? And that's a serious issue, and we do not have a good answer at this moment, and we have to keep discussing this point. Thank you.
If you have some more questions to your counterpart, please.
No, I just wanted to ask Professor Nangaku if he thinks that, I mean, what I got from the discussion here, which is very interesting, is that there are lots of similarities between France and Japan in terms of how we reacted to this epidemic. We have this tendency in Europe to idealize the Asian countries as being extremely responsive and extremely sensitive to these epidemics, but I heard that it was not as easy as it sounded to convince the Japanese people to protect themselves. I've heard that there were also issues with regard to science and the need to increase the support to basic science and to develop mechanisms to quickly react to crisis and transfer the basic knowledge to products, to tools for the control. And France and Japan clearly haven't done so well. And I think we basically need maybe to talk together to how some countries which have not necessarily done as well as anticipated in this crisis, how they should get organized. The hospital system, even if it's structurally different, clearly has the same issues like profitability, and so telemedicine is a big issue in France, but we still have areas in France where the internet is very unstable, and what we call medical deserts. And there's still a long way to go, and I wish health really becomes a visible priority, because this pandemic has really shown that it was one of the most precious thing that we have, which is our health and the health of our children. So I think we have a lot of things in common with regard to our successes and failures to respond to this pandemic.
Thank you very much, Professor SANSONETTI and NANGAKU, for your very fascinating dialogue. And now the time is up, and I would like to thank you very much once again, and I hope that discussion continues like this within the framework of partnership between the University of Tokyo and Collège de France and Institut Pasteur. Thank you very much.